7 signs your body gives when your heart isn't doing well. In today's video, we're diving into the 7 signs your body might show when your heart isn't in good shape. Cardiovascular diseases are the #1 cause of death worldwide, making it essential to understand these warning signs. Hi, I'm Dr. Marcos. Welcome to You Stronger channel. Before we get started, let me know in the comments where you're watching from. We'll break down this video into 3 main parts. 1. The 7 visible signs that might indicate something is wrong. 2. Symptoms you might feel if your heart is struggling. 3. And finally, valuable tips to help you avoid heart issues in the future. But before we get into these important details, don't forget to subscribe to You Stronger channel and give this video a like. Every like helps us reach and support more people. Can I count on you? What are the 7 signs you should look out for that might indicate heart problems? 1. The diagonal earlobe crease. Today, you'll be paying a bit more attention to your ears. Yes, really. There's a small but significant sign that might appear on the earlobe, pointing to possible coronary artery blockages. This sign, called Frank's sign, was first identified by Dr. Sanders T. Frank in the 1970s. Dr. Frank noticed that many patients experiencing angina had a diagonal crease on their earlobes. But what connects the heart to this earlobe crease? One theory suggests that factors damaging artery linings may also lead to this diagonal mark on the earlobe. Does everyone with Frank's sign have blocked arteries? Not necessarily. Among 100 people with this crease, about 30 won't have any artery issues. It's simply an age marker. However, the remaining 70 might have a blockage, especially if they are younger. For instance, a 40-year-old with this sign warrants closer attention compared to an 80-year-old due to age-related risk factors. The accuracy of this sign is relatively low, as only 40 out of 100 people with blocked arteries will show it. So, if your earlobes are smooth, don't celebrate just yet. 2. Leg hair loss. Next is the loss of hair on your legs, particularly at the top and then the bottom. Most people with peripheral artery disease, PAD, don't notice anything wrong until atherosclerosis is at an advanced stage. But why does hair loss occur? Hair follicles need nutrients to grow, and these nutrients rely on a steady blood supply. If your arteries are clogged by fatty plaque buildup, blood and oxygen struggle to reach these areas. In addition to hair loss, someone with PAD might also notice smoother, shinier skin on their legs, colder skin, and slower nail growth. But keep in mind, hair loss on the legs can happen for reasons beyond PAD. Genetics and friction from tight shoes can also play a role. 5. Xanthelasma. Have you ever seen a small yellowish patch on someone's eyelid? This is called xanthelasma. It's harmless and usually just a slow-growing cosmetic issue. Xanthelasma is actually a common type of xanthoma, which are fatty deposits under the skin. These patches are more common in older women and are typically found in the inner corner of the eye, often on the upper eyelid. Around 50% of people with xanthelasma have high cholesterol or triglycerides. Interestingly, only 1% of people with high cholesterol have xanthelasma. However, research suggests that having xanthelasma can increase the risk of heart disease and heart attack. So, if you notice xanthelasma, it's a good idea to get your cholesterol and triglycerides checked. 4. Arcus senilis, or senile ring. As the name suggests, arcus senilis is associated with aging. It appears as a white or gray ring around the edge of the cornea, visible above and below the colored part of the eye. Sometimes, this ring may even circle the iris completely, making a dark eye look lighter over time. Arcus senilis doesn't affect vision or require treatment. However, there is a twist. If this ring appears in younger people, under 45, it might indicate severe cholesterol or triglyceride issues and an increased risk of heart disease. In older adults, this is common. About 60% of people over 60 have it, and by age 80, nearly everyone does. So, if you're over 60 and see this ring in the mirror, it's generally nothing to worry about. 3. Cyanosis. Cyanosis refers to a bluish or purplish tint to the skin. It could simply mean you're cold, but it might also point to a heart or lung issue if it persists when you're warm. Other possible causes, such as congenital defects like tetralogy of Fallot, can lead to cyanosis. Second sign, ulcers. Wounds that do not heal on the legs or feet may indicate poor circulation. This could be caused by insufficiency due to a blockage in the artery supplying that area. Usually, the person cannot walk much or quickly due to pain, anxiety, or cramps in the legs. Most of the time, these ulcers are painful. However, if you have nerve involvement, such as neuropathy, you may not feel pain. Arterial ulcers generally appear on the outer part of the leg, knees, and toes, and are typically painless. Venous ulcers are more common and are associated with varicose veins or venous thrombosis. They affect the inner part of the leg and are usually more painful. First sign, pain in the legs, feet, and ankles. This pain or swelling in the legs and feet could be caused by a weak or dilated heart that accumulates fluid in the body. You might notice that your shoes feel tighter or firmer. The feet may feel swollen, like bread in the oven, and when pressed, an indentation forms, which we call a fovea sign. This pain is more likely to be noticed in the legs and ankles at the end of the day because gravity increases the pressure in the veins. If you sit and elevate your legs, the pain may decrease. Now, what are the 7 symptoms you may feel that indicate a heart problem? First symptom, shortness of breath, dyspnea. Particularly when exercising, it becomes disproportionately difficult to breathe. You may find yourself short of breath with any activity, which could indicate a heart problem. Second symptom, persistent cough with white or frothy phlegm. This indicates fluid in the lungs and alveoli. It is important not to ignore this cough. See a doctor. Third symptom, difficulty breathing when sitting. The person starts using more pillows to sleep better, and over time, they may be unable to sit down and may need to sleep in a chair. They may also wake up gasping for air during the night, a condition known as paroxysmal nocturnal dyspnea. This indicates a heart problem. Fourth symptom, general weakness. Feeling tired all the time and having difficulty with daily activities like shopping, climbing stairs, carrying groceries, or walking. This occurs because the heart is unable to pump enough blood to meet the muscle and tissue needs. Fifth symptom, nocturia. Waking up multiple times at night to urinate is called nocturia. It has several causes, but if the heart is not pumping properly, the excess fluid in the body needs to be eliminated. Sixth symptom, intermittent claudication. When you walk a few meters and feel pain in your calf, it is not constant, but only when exerting effort, and it improves when you stop. This symptom means that blood is not reaching that area as it should. When you walk, it hurts, but when you stop, it gets better. Seventh symptom, chest pain. If you experience chest pain, the first thing you should think about is a heart problem. Don't assume it's muscle pain, gas, or something simple. It could be, but first, you need to rule out more severe issues. Chest pain is any discomfort in the chest that lasts for more than a few minutes. It may come and go, feel like pressure, weight, heat, or burning. It could radiate to the left arm, leg, knee, stomach, or both sides of the abdomen and may or may not be accompanied by sweating, dizziness, nausea, or anxiety. If you have these symptoms, see a doctor as soon as possible. Now, how to prevent heart problems. 1. Exercise. Don't stay inactive. Physical activity is very important for circulation, heart health, and well-being. Low-impact exercises such as walking, cycling, and swimming can improve blood flow caused by chronic obstructions in veins and arteries. 2. If you smoke, quit. Smoking is one of the worst things for your health. It causes impotence, inflames all your arteries, and forms plaques that increase the risk of stroke, heart attack, and dementia. 3. Lose weight if you're overweight. Excess weight increases pressure, blood sugar, inflammation, and overburdens the heart, veins, and venous system, increasing the risk of thrombosis. It also increases liver fat. 4. Eat healthy. Eat lots of fruits and vegetables, fiber, whole seeds, olive oil, and limit red meat and processed foods. 5. If you have a family history, especially parents or siblings with heart problems, heart attacks, heart surgery, or coronary issues, you should be more attentive than others. If many in your family have heart problems, you should have more frequent checkups. 6. Take care of your cholesterol and triglycerides. Eat more whole grains, avoid trans and saturated fats, lose weight, eat more fiber, and exercise. If, despite doing everything right, you can't reduce your cholesterol, don't be alarmed if your doctor prescribes medication. 80% of cholesterol is made by the liver, so sometimes doing everything right isn't enough. 7. Keep your glucose levels under control. If you are diabetic or pre-diabetic, keeping your glucose levels well controlled reduces complications. Your A1C should be below 7%. 8. Finally, control your blood pressure. Your goal should be to keep your blood pressure below 120/80. For some, the target may be slightly higher, such as not exceeding 140/90. And, of course, if you suspect you have a heart problem and experience any of the symptoms I've mentioned, seek medical advice. I hope this video helped you. Share it with a friend or family member to spread the knowledge. Don't forget to subscribe to my channel. It will help this content reach more people around the world. Thank you so much. Legal disclaimer. This video is for educational purposes only, aimed at instructing the public on various topics related to medicine and general health. The information provided in the videos is not intended to replace medical consultations or serve as recommendations for any treatment plans. If you have any questions, please consult your doctor. Medicine is a constantly evolving field, and the videos are based on the most recent scientific articles available at the time of production. The videos are strictly for educational purposes only and do not disclose addresses or phone numbers of any office, clinic, or service.